Hello everyone. Welcome to the Editorial vocabulary, reading and summary presenting by Diction Addiction. Today Editorial title is Faster, Sooner on the need to accelerate COVID-19 vaccine. The first section is vocabulary. In the vocabulary section, the editorial is dissected for important and new words. These important new words, meaning, pronunciation, and usage will be discussed. The first one is rollout. Service or product which is introduced into the market very first time, that process is called as rollout. Roll out the vaccine. Roll out the vaccine. Comorbidities. Person who is suffering with the more than two diseases, two or more than two diseases simultaneously in a patient, that they are called as comorbidities. Immaterial, not relevant to the subject. This discussion is immaterial to that one. Means it's nowhere relation. Indeed means indeed we are discussing the same issue. Means certainly or really, indeed. Critically, something you are looking at, some subject you are looking at critically, means you are criticizing way you are looking at that. Means very bad and serious way you are looking at. Restrictive means you have a limited freedom to perform, or limiting the someone freedom is called as restrictive zones. Means you have flexibility to, you don't have flexibility to move here and there. You are COVID-19 restrictive zones. So your freedom is limited. That is called as restrictive. Severe means very bad. Something is very severely damaged. Severe accidents. Certificate. What is meant by certificate? Official documents attesting the fact is called as certificate. I have 10th class certificate, intermediate certificate means you have been passed or got a first class or second class or third class. That's a fact. So the document is attesting your credential or fact is called as certificate. Unachievable means difficult to achieve. The task is unachievable. Vast, so much, large extent. Ignorant, lack of knowledge or awareness in general. He is ignorant of that law. Means he is not aware of that law. Lack of knowledge. Underlying, the thing which is beyond the main thing, underlying concerns. Underlying reason why you are performing, why you are doing, what is the underlying reason for that. Belated means late. Supposed to come on time, but it has come late. That's what is belated happy birthday to you. Commendable means deserve praise, appreciate, laudable. Commendable work means it is appreciated. Tool, the device or implement held in the hand to perform some task. Artificial, it's a man-made things, not natural one. Barriers, fence or obstacles which will stop the slow down the, prevent the movement or access is called as. So during my studies I have faced many barriers. I have to work on the barriers to reach my goal. Means financial barriers. Witnessing means experiencing, by seeing or hear by personal presence or perception. So I'm witnessing the surge of COVID-19 cases. I'm able to see the difference in the number of cases or number of people who are affected with the COVID-19. Surge means sudden upward and powerful movement. Surge means a lot of cases are coming at a time. Hesitancy means not ready to do something immediately. COVID-19 vaccination has become a hesitancy to even medical professionals also. So they're not ready to take up. They're initially means at the beginning. Willingness just opposite to the hesitancy. Ready to perform or do something. Administered means taking through the different routes. Steadily means constantly or regularly even manner. Addressing means formal speech. Shortage, something which you require, but the supply is limited. That is what is called as shortage. Lukewarm means generally lukewarm water means warm water. Here lukewarm means don't get the very good response or not showing the enthusiasm to perform. Lukewarm response from the people to perform that action. Participation, the action taking part of something is called as participation. Expansion, becoming large. Universal, it is covers all the people in the world. Universal immunization means immunizing to the everyone. Wherewithal, this is a very important word. It means money or ready cash is called as wherewithal. Accelerate, increasing the speed. We need to accelerate the COVID-19 vaccination so that we can control the new cases. Reflected, throwing back without absorbing. When you hit someone, you will reflect. It will hit you back. That is a reflection. Awareness, having a knowledge or perception of the situation or a fact is called as awareness. I'm aware of the current scenario. Means you are aware of that. Means you know the A to Z of the current situation around you. Exercise, action intended to improve something. Over-reliance means too much dependence on the too much dependence is called as over-reliance. Passive means accepting or allowing something very passively. You're not questioning. You'll not question anything. That is what is active and passive. Outreach, the extent or length of outreach programs. Micro planning means you are involving the people and their decisions. So you are taking the concern of the people and their decision is called as micro planning. Yeah, we have come to the second session, second section, that is reading, loudspeaker reading. Just 3 weeks after it rolled out the second phase of mass vaccination program for people above 60 years and those above 45 years with the comorbidities, India has now undertaken course correction to vaccinate anyone above 45 years immaterial of comorbidity status from April 1st. By following the UK model of vaccination based on age bands rather than comorbidities, millions would become eligible to receive the vaccine and be fully protected. Indeed, people with the comorbidities are at greater risk of becoming critically ill and even dying. However, the list of the comorbidities that made a person eligible for vaccine was not only highly restrictive, but also focused on multiple comorbidities, and that too of severe nature. Also, the need for medical certificate meant that vaccinating as many as people as quickly as possible was unachievable. Since a vast majority, particularly the poor and those in rural areas, are ignorant of their underlying disease. The decision, through though belated, to make comorbidities redundant for a vaccine is commendable. As vaccines are a tool to promote the health equity, all attempts should be made to remove any artificial barriers. More so when several states are witnessing a surge in cases. While hesitancy towards the two available vaccines was partly responsible for low uptake initially, there is now increasing willingness to get vaccinated. While 0.8 million doses administered on February 25th was the highest before the second phase began. The numbers have been rising steadily thereafter. Increasing the gap between the two Covishield doses partly address vaccine shortage. At the 7-day rolling average crossed 2 million doses per day only in last couple of days. Only about 50.23 million doses have been administered as on March 24th, or less than 4 doses per 100 millions. The vaccination program has also been witnessing lukewarm participation by private medical facilities. The reason for this, besides the slow phase expansion in some states, need to be fixed. Though COVID-19 vaccination, which targets adults, is vastly different from universal immunization program. India has the wherewithal to accelerate the daily vaccination rate. What is missing is political will to achieve that, reflected in absent targets and awareness building exercise, including vaccine safety, vaccine sites, and permissibility of walk-ins. Also, unlike immunization program, over-reliance on COVID platform has made vaccination to the largely passive, facility-based exercise rather than the public health initiative. Lack of micro planning and outreach activities are further impacting uptake. Clearly, there is a case for reaching out to the people to quickly increase vaccine uptake. Yeah. So this is all about reading. And now we come to we will look into the statistics of vaccination in the world for 100 people. So the topmost country as of now is UAE, United Arab Emirates, where 81 people are vaccinated out of 100. Next one is Chile, 53 per 100. UK is almost 50-50, 51 for 100. USA, 44 for 100 people. China, 8 for 100 people. And India, it's close to the 4.5 for 100 people. So as per the plan, when the government started roll out the vaccine in January 16th, 2021, by now it is almost 3.5 months, almost 2.5 months. So they wants to wind up they want to vaccinate every person of health and frontline workers, and finally 50 years above with the comorbidities and 60 and above of all people. This total number comes to the 30 crores. That's this target they want to finish by in the first 3 months. But as of now, they could reach only 6.5 crores only. Why? Because there are n number of reasons for that. Yesterday I have seen on daily newspaper said that uh, in even in the medical field, around 40 to 50% people are only taken the vaccine. Remaining 50% are they're on the wait and watch, wait on that stand. So because of the many reasons, one is that people who are people with the 60 are eligible, but they can't come to the site, and they have to register with the COVID, right? These are the problem. And people who are above 50, and comorbidities as of now, because many of the people who are living in rural as well as semi-urban also, many people don't know that they are suffering with the any kind of diseases. Especially if they want vaccination, they need to get the certificate. Certificate getting is the most difficult one, and also over-reeling on the COVID vac. So, and also last not least, the vaccine hesitance also attributed to the, people are, for example, two vaccines are available. One is 60% efficacy, other one is the 80% with the limited number. Initially, there was no data for that. So these are the factors which are attributed to the lukewarm response to the vaccination. Now government open the vaccination to the people who are 45 and above, irrespective of the comorbidities. So in the last couple of months, almost 6.5 crores people have vaccinated. If the same phase goes, probably we may need 5 years to complete the entire vaccination. But now the vaccination program is open for the 45 and above. I think the vaccination going to be accelerated, because uh, registration with the COVID seems to be not mandatory, and you can get the vaccine from the even it's all available in the medical, private medical facility also. So I'm hoping that the vaccination will pick up, and the vaccination is the only way to control the transmission from one person to other person. So as if the vaccination goes well, and within a year or so we can achieve if you can achieve the at least 70% of the people are vaccinated, 60 to 70% of the people are vaccinated, then rest of the 30% need not to be vaccinated, because that's enough for the herd immunity. To reach the herd immunity, we need to strengthen our planning and political will, and we have to do many awareness programs about the safety, efficacy, and reactivity of the vaccines. And we need to be more flexible in the vaccination. I have seen that to achieve some targets, even in Tamil Nadu, the medical people or health people are visiting the door-to-door to vaccination. So this kind of initiation would help us to get the vaccine, and that vaccination will lead to the herd immunity, and we can have a normal life within no time if everybody agrees to take a vaccine. So this is all from now. The big news is tomorrow onwards, people who are 45 and above, irrespective of the comorbidities, they are eligible to take the vaccine. I hope that people will come and take the vaccine, and that should be their responsibility instead of someone is motivating them. Thank you. And if at all you like it, this is what going to be happen. If at all you like it, give a thumbs up. And for regular updates, just do subscribe. Thank you. See you again with one more article. Until then, bye bye.